Thanks to RDO for this amazing day. Thanks for being here, everybody. My name is Paula Fleischer. I work for the Community Engagement Health Policy Program, CTSI, obviously. Could I just see a show of hands of who currently involves community members, stakeholders in your research? That are great, or folks who are interested in that? Kind of piques your curiosity? Okay, cool. Oh, thank you, Molly. I'm glad my colleague Molly is interested. Thank you. Okay, so I'll be brief, but I hope you'll find this piece of research infrastructure at UCSF interesting, and please do see us afterwards at a table to learn more. Why would you do community engagement? It definitely has been shown that stakeholder, and we can define community very broadly. We often then rename it stakeholder engagement, makes research more relevant, effective, and impactful. It's very important. And stakeholders, we are including large number here and types: patients, caregivers, community-based organizations, civic agencies, policymakers, payers. It's when you think about who's impacted by your work, we are here to help you involve them in your research. We offer consultation services. These are our service package, kind of. We have a linkage service, so we actually do kind of a matchmaking service, if you think about it that way, and we do training in best practices. We also manage a clinic-based network, a practice-based research network of more than 3,000 clinicians who are ready and interested in partnering in research, and that's called the SFBA Collaborative Research Network. My colleague James is here. He manages that network, and he's here with me today to help you learn more about that. And then we have also, we are part of several non-clinical or semi-clinical multi-sector collaborative projects that we can plug you into. San Francisco Health Improvement Partnership, the Tenderloin Health Improvement Partnership, the Cancer Center's multi-sector collaborative SF-CAN, and others. And just to say that definitely our framework is a health equity framework, and all of our services are finely honed to help you with that. How to get in touch with us. This is CTSI's website, and there's a great list of programs up at the top menu. Just sort of go to CTSI and look at programs, and you'll find us there. Here's what our page looks like. That's the best way to find us. And then when to get in touch? Basically, anytime is a good time. Of course, we recommend sooner rather than later, since these phases in research, everything from designing your question to disseminating your findings, there are important roles for stakeholders in that work. And in fact, we would start with you planning for dissemination as you're designing your questions. So these things aren't necessarily linear. They can be, but get in touch with us anytime, and we're happy to help. So the bottom line really is about building trust, and building trust with the institution, involving folks in your studies, and you will see the benefits, and of course your stakeholders will feel and see the benefits the sooner and the more you involve them. This is a picture of a community advisory board that we help to facilitate and evaluate and hold together. So this is the Child Health Equity Institute's Transforming Research as Usual for Equity Community Advisory Board. Families who are involved in prioritizing research questions for their communities. And they came up with over 80 research questions that they want UCSF to address. So there's a lot of passion and interest and willingness to work with you out there, just so you know. We are closely affiliated with the Center for Community Engagement, which is another center we want to make sure you know about. And the Center for Community Engagement does all of this and more, also focusing on UCSF as an economic engine, and we are looking at more equitable ways for UCSF to engage as an employer and procurement, that kind of thing. But definitely check out the Center for Community Engagement. Here's a list of who we are. Here's the faces of who we are. You'll see, okay, there you go. Check us out. Come talk to us afterwards, and we'd be happy to tell you more about what we do and give you a few examples of how much research benefits from community and stakeholder engagement. Thank you.